Okay, so write down the treatment. Okay, number 1 is place the conscious casualty in a half sitting position. Kotha pati asa Jondeep. Casualty in a half sitting position with the head inclined towards the injured side. With the head inclined towards the injured side so that blood or fluid can drain. So that
Ma'am, inclined to one.
inclined towards the injured side. Wherever the injury is, you will have to incline towards the injured side. Incline towards the injured side so that blood or fluid can drain. So that blood or fluid can drain. DRAIN drain. So that blood or fluid can drain. DRAIN drain. Number 2, cover the ear. Number 2, cover. COVER. Cover the ear. EAR ear with a sterile. Sterile mane clean. Okay. With a sterile. STERIL sterile, comma, unmedicated dressing. Sterile, comma, unmedicated. UNMEDICATED. Unmedicated dressing. DRESSING dressing or similar clean, comma, or similar clean, CLEAN, similar clean, comma, preferably sterile material. Preferably sterile material. Full stop. Secure it very lightly with a bandage. Secure it very lightly, tightly, sorry. Secure it very tightly with a bandage. Tightly with a bandage or adhesive strapping. Or adhesive strapping. Or adhesive strapping. Or adhesive strapping. STRAPPING. Adhesive strapping. Number 3, check breathing rate. Check breathing rate. BREATHING. Breathing rate. RAT rate. And level of responsiveness at 10 minutes interval. And level of responsiveness at 10 minutes interval.
Ma'am, and level up or develop?
Level. LEVELS. Levels of responsiveness. RESPONSIVENESS. Responsiveness at 10 minutes interval. That means you have to check the breathing rate. What is the normal breathing rate? Breathing rate means your respiratory rate, okay? Your respiration. What is the normal range? Anyone? Achal? Anchal, Rana Magar? Do you know what is a normal breathing rate? Anyone? Sir? You don't know? Srijana?
Yes,
Normal
ma'am.
breathing rate is?
16 to 20 breaths per minute.
Yes, 16 to 20 breaths per minute. Not breathe, okay? Breaths. BREATHS. So you have to
Okay,
check
ma'am.
the breathing rate. Okay, that is the respiratory rate you have to check. And also the level of responsiveness. Level of responsiveness means when you are talking with the patient, like, hello, can you listen to me? What is your name? Are you fine? Like that. If they respond, yes, I'm fine. Or if they answer you back, that means the level of responsiveness is good. But if the patient is not replying, that means the condition is serious. Okay, so after every 10 minutes, after every 10 minutes, you will have to check the level of responsiveness and also the respiratory rate. Okay. Then next, number 4, you write minimize shock. Minimize shock. Minimize. M-I-N-I-M-I-S-E. Minimize shock. S-H-O-C-K. Shock. Minimize shock. And about shock, we will discuss in brief in later. Okay, in the next class. We have a whole topic for shock. After hemorrhage, we have shock. Okay. So minimize
Ma'am,
shock.
ma'am, after this point number 3 then,
Minimize shock.
interval.
Number 4 is minimize shock. S-H-O-C-K. Shock. About shock, we'll discuss in the next class. It's a whole topic. Okay. Then number 5, write down. If the casualty becomes unconscious, if the casualty becomes unconscious, if the casualty becomes unconscious, if the casualty becomes unconscious but is breathing normally, but is breathing normally, B-R-E-A-T-H-I-N-G, but is breathing normally, comma, place in the recovery position. Huh? If the casualty becomes unconscious, if the casualty, C-A-S-U-A-L-T-Y, if the casualty becomes unconscious, U-N-C-O-N-S-C-I-O-U-S, unconscious, but is breathing normally, but is breathing, B-R-E-A-T-H-I-N-G, but is breathing normally, comma, place in the recovery position. Place in the recovery position, full stop. The head should lie on the injured side. The head, H-E-A-D, head. The head should lie, L-I-E, lie, on the injured side. The head should lie on the injured side to allow fluid to drain. To allow fluid to drain. To allow fluid to drain. Number 6 point likha. If breathing and heartbeat stop. If breathing, if breathing and heartbeat stop. If breathing and heartbeat stop, comma, begin resuscitation immediately. Begin resuscitation. R-E-S-U-S-C-I-T-A-T-I-O-N. Begin resuscitation immediately. Resuscitation means CPR, okay? Cardiopulmonary resuscitation. We will discuss about this in the next class. Okay, it is a whole topic. In practicals, we will discuss it later. So I won't discuss now. If breathing and jodi tumar breathing, okay, if your respiratory rate and your heartbeat stops, your pulse rate decreases or it stops, then you will have to start CPR, that is cardiopulmonary resuscitation. The last point you write, number 7, remove to hospital. After doing all this also, if the casualty is not good, then you should take the casualty to the hospital. Remove to hospital. H-O-S-P-I-T-L. Remove to hospital. Okay, so this is all about bleeding from the ears. Now you write number 4, bleeding from eye. Your soku. Nah, your eyes. Bleeding from eye. E-Y-E-I. Bleeding from eye. Bleeding from eye. Write down, all eye injuries are potentially serious. Symptoms and all eye injuries are potentially serious. Your eyes are the most delicate part of your body. Okay, so obviously any injury to the eye is very, very serious. Okay, because eyes are the most delicate part of your body. So right, all eye injuries are potentially serious. Full stop. Symptoms and signs. Symptoms and signs. Number 1, partial or total loss of partial or partial or total loss of vision. Partial or total loss of vision, VISION, vision in affected eye, in affected, AFFECTED, in affected eye, even with no visible injury. Affected eye, even with no visible injury. Okay, if the eyes get affected, what does it mean? That there can be partial or there can be total loss of vision. Okay, but when we see the person's eye, it will be like there is nothing, it's all fine, but only the person will know that there is a partial or complete loss of vision. Okay, if there is an injury to the eye, so there is no visible injury from outside, kintu it is damaged from inside. Okay, from outside you can't know, but from inside, yes. Number 2, painful. Number 2, painful. Number 2, painful, comma, painful, comma, bloodshot eye, blood, BLOOD. Bloodshot, bloodshot, BLOOD, bloodshot, SHOT, shot, bloodshot eye, EYEI, comma, possibly with a visible wound, possibly with a visible wound, possibly with a visible, VISIBLE, with a visible wound, WOUND, wound of eyeball or eyelid, of the eyeball or eyelid. Bloodshot, eyeball or eyelid, EYEI, lid, 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 your eyelids. Okay, bloodshot eye mane ki, what is what is bloodshot eye? Bloodshot eye means the eyes will turn red in color. So go to wrong, it will become red in color. Okay, your eyes will look red. So that is bloodshot eye. It will be painful. It will be redness of the eye, and also there will be visible wound. Okay, in your inside your eyeballs and the eyelids. If you don't know eyeball and eyelids, you see in Google, you can see the pictures, you will simply know which one is eyeball, which one is eyelid. Okay, now I can't show you because I didn't take the pictures for that. Then last point to Likha. Number 3, loss of blood, loss of blood, loss of blood, loss of blood or clear fluid from the eye, or clear fluid from the eye, or clear fluid from the eye, or clear fluid from the eye would possibly wound possibly with from the eye wound possibly with flattening of the
Ma'am, wood or wool?
hmm?
Wood or
Loss of
wool?
blood or clear fluid from the eye wound, WOUND, from the eye wound, possibly with flattening of the normal
Ma'am, I can't hear you.
I said loss of blood or clear fluid from the eye wound, possibly with flattening of the normal round, possibly with flattening, flattening, flattening of the normal round contour of the eyeball, of the normal round, R-O-U-N-D, round contour, C-O-N-T-O-U-R, contour of the eyeball as a content leak, as a content leak, as a content leak, L-E-A-K, leak. So these are some of the signs and symptoms of from bleeding of the eye. Okay, next you write down the treatment. Next you write down treatment. Number 1 likha, lay the casualty down on the back. Lay the casualty down on the back. Lay, L-A-Y, lay the casualty down on the back, B-A-C-K, back, comma, support the head, support the head, support the head and keep it as still as possible. Support the head and keep it as still as possible. That means you will have to make the patient or the casualty lie down in a flat surface. Okay, in a supine position. Supine position means straight. You know how do you sleep at night? Mostly you prefer the supine position. Okay.
No.
Yeah, the normal position, the straight position. So you will have to make the casualty lie down, okay, in a supine position, and you have to support the head, and you will have to keep the head, okay, the head as still as possible. There should be less movement of the head, okay, because there is injury to the eye. So you will have to keep the head still, S-T-I-L-L. Number 2, write down. Ask him to close the Number 2, ask him to close the injured eye. Kiki, what? हाँ रूप की
More jewelry पे होती है
from the eye.
मैं fast forward होगी casualty long
starting
later
treatment
casualty
number 1.
episode
अच्छा treatment number 1
yeah head होती है जूली पे
তেনেহলে কোনটো sign and symptoms which one रूप
मैम जूली पे treatment number 1 तो होती है
loss of blood इडू
मैम जूली पे treatment number 1 तो होती है हाँ
loss of
ना
blood
treatment what one
treatment number 1
हाँ जूली पे हेड होती है
treatment number 1 lay the casualty down on the back, lay the casualty down on the back, comma, support the head, H-E-A-D, head, and keep it as still as possible, still, S-T-I-L-L, and keep it as still as possible. Still means there should be no movement, okay? Keep it as still as possible. Got it, Roop? Lihisane,
yes
Roop?
ma'am
Okay. So number 2, write down. Ask him to
लिखिए
close
सर
the. Okay. Number 2, ask him to close the injured eye. Ask him to close the injured eye. Ask him to close the injured eye and gently cover it. And gently cover it with an iPad. And gently cover it with an iPad, comma, secure it with a bandage or adhesive plaster. Secure it with a bandage or adhesive plaster. Adhesive, A-D-H-E-S-I-V-E, HESIV, adhesive plaster. So whichever eye, whether it be right eye or left eye, any eye, okay, whichever is injured, you will have to ask him to cover it with a gauze pad. Okay, I guess you have seen some people, their one eye used to be closed with a pad. Have you ever noticed? Have you ever seen?
Yes, ma'am.
Atasoku means one eye used to be closed with an iPad. Why? Because they have some kind of injury to the eye. Okay, whenever they go to hospital, to optha, they used to close one side of the eye, the injured side. Okay. Number third point you write down. Advise the casualty to keep the eye still, STILL, to keep the eye still, because movement will cause the injured eye to move. Because movement will cause the injured eye to move. MOVE, move. Full stop. Advise the casualty to keep the eye still because movement will cause the injured eye to move. So you should not allow him to move around, okay?
I can hear you.
Sure. Okay. So the last point you write down, remove him to the hospital. The last point, remove him to the hospital.
Ma'am, the last point is number 4.
Yes, number 4, remove him to the hospital.
Oh,
Okay, if the condition is too worse, you will have to take him or her to the hospital. Remove him to the hospital.
Ma'am, number 3 till to move. Or
Yeah, to move. Advise the casualty to keep the eye still because movement. Okay, so now there are 2 more things, that is bleeding from mouth and bleeding from the gums. So these 2 things I will click picture and I will send you in group. You can write it down. Okay, you can note it down. Is it okay?
okay, ma'am.
okay, ma'am.
Baki ase. Okay,
Okay,
only two is left, that is bleeding from the mouth. Okay, from inside the oral cavity, whenever there is a bleeding, that is left, and bleeding from the gums. Okay, so these 2 things are very easy, so I will just click pictures and send you in your WhatsApp group. You can note it down. Okay, so after this
Okay,
we
ma'am.
will start with a new chapter. Okay, that is on shock. So okay, thank you then. Please give me the attendance. Okay.
Thank you, ma'am.
Thank you, ma'am.
Should I take the attendance one by one
Good
or
night, ma'am.
are listen?
Yes.
Ma'am, one by one. No.
Huh?
One by one. No.
One by one.
No, Anya is finished writing.
See, you have 1, 2, 3 like that, na?
Anya likhi ase pahunche.
Your roll number is serial wise, na? 1, 2, 3, 4 and
Yes, ma'am.
Okay. Let
Yes,
me
ma'am.
take.
Ma'am.
Okay. Hey, it's okay. You please write and give it to me. Okay, my remaining time is also getting over. So it will be problematic. From tomorrow,
Okay,
if
ma'am.
possible, I will take it. Okay. Thank you.
Thank you,
Mm,
ma'am.
okay.
Thank you.
You can end the meeting. You can leave the meeting.
Na 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 na